Our patient is Veronica Cooper. She's a 30-year-old female. She was diagnosed with multiple sclerosis in 2018. Her symptoms include pain, weakness, and fatigue. Our patient reports no medical conditions other than multiple sclerosis. She's taking multiple medications to treat the condition, which includes mitoxantrone, interferon beta 1A, PEG interferon beta 1A, and methylprednisolone. Our patient is taking 4 medications for the treatment of multiple sclerosis. The first is mitoxantrone, which is an anti-neoplastic agent used for the treatment of MS. This can cause mucositis and stomatitis. She is also taking interferon beta 1A for the treatment of the relapsing forms of MS. This can cause xerostomia and toothache. She is taking PEG interferon beta 1A for the treatment of relapsing forms of multiple sclerosis, which can cause bleeding. And lastly, she is taking methylprednisolone, which is a corticosteroid. This can cause ulcerative esophagitis.
Upon completion of the oral exam, we found xerostomia and stomatitis, which are common side effects of the patient's drugs. We found 4 possible carious lesions on the molars, and upon probing, we found generalized 4 to 5 millimeter pocket depths, slight recession on the canines and premolars, and bleeding on the mandibular anteriors. The risk of caries and periodontitis are increased in patients with multiple sclerosis. We classified Ms. Cooper as Phase 2 Grade A periodontitis as a manifestation of systemic diseases. She is a Class 3. Because Ms. Cooper is having trouble adequately removing plaque, we discussed OHI and modifications. We showed her succular toothbrushing as well as C-wrap flossing and had her repeat this to us. We also recommended the use of an electric toothbrush with a larger, easy-to-grasp handle because she has limited dexterity, as well as a water pick or flosser with a handle. We discussed the role of plaque in gingivitis, periodontitis, and calculus. Ms. Cooper understands that plaque occurs naturally on the teeth, but that it is important to remove it daily. She understands that a buildup of plaque can turn into calculus, which can harbor even more plaque, and that her body's immune response to this plaque leads to gingivitis and periodontitis. She understands that her gingivitis is reversible, but that her periodontitis is not, and that it is very important to fix her habits now so that it does not progress further. We also discussed the caries process. She understands that it is important to avoid snacking on foods with lots of sugar because this can lead to acid production that can lead to caries. We suggested a saliva substitute to help with her xerostomia, which results from her medication. We also recommended always using a toothpaste with fluoride as well as an antimicrobial and fluoride mouth rinse to help protect against caries and periodontitis.